Greetings from Geneva, Switzerland. This is Reda Sadki. I'm here with Charlotte Mbou, who's based in Iboloa, Cameroon. Charlotte, how are you doing? We're 1 minute and 30 seconds away from this movement celebration.
I'm doing very great, Reda, and I'm so excited to be here today.
Indeed. So 1 minute, 24 seconds. You can see the countdown on your screen. Many hundreds in the room already in our Zoom studio, and then across social media we're seeing people coming on. If you've just connected, we're about 1 minute away from starting. Do send us, tell us where you are based, your city, your country. Tell us what you do and what you have to say for World Immunization Week. Many of you were involved in activities last week, so tell us what you did. And see you in 55 seconds. In 40 seconds, we'll be kicking off this movement celebration for World Immunization Week. And we already have a greeting for Aid from Amel Altahir. Greetings, everyone. Amel says, connecting from Saudi Arabia. We'll be, of course, honoring our Muslim colleagues. We're celebrating a very important moment today. In 15 seconds, with people from all over the world. Let us know where you're from. 10 seconds. You can count down with me. And if there were this many people in the room together, yes, Maria, you should be able to connect your video. So, just over a year ago, we asked you, what is the future of immunization? And the world's countries have come together to set the agenda for immunization. It's called Immunization Agenda 2030. And this event is happening under the banner of the Movement for Immunization 2030, Immunization Agenda 2030. I'm here with Charlotte Mbou. Charlotte, how are you doing? What are you feeling? There's hundreds of people in our Zoom studio. What's your sense of the group here?
I'm feeling very excited, Reda, because the excitement in the room is actually contagious. So I'm very excited and very happy to be here because we are actually, I think this is the cap moment for the World Immunization Week, and the best way to celebrate it is with the Movement for Immunization Agenda 2030.
That's right. And before we go any further, we'd like to send greetings to our warmest wishes to all Muslim colleagues who are celebrating Eid and marking the end of Ramadan today. In most countries, after a month of prayer, fasting, giving back, the entire team at the Geneva Learning Foundation hopes you are able to enjoy this time of celebration and community. Now, today is our World Immunization Week celebration. Before we go any further, I also want to introduce and welcome and thank our many partners. You can see them here on the screen. These are global, regional, country partner staff from all of these organizations who registered as partners. We're going to give them a round of applause. And also thank to Babe Queen Ninsen, who just shared the photo stories. We want to say hello to Mohamed Issa Mohamed, who's writing to us en français, in French. We're connecting from LinkedIn. Now, just to dive right in, what are we doing today? First of all, we're going to open with a message from the Women Who Deliver Vaccines Collective. Charlotte will be telling you who that is and why they have formed the collective. Second, you'll be hearing from leaders of the Movement for Immunization Agenda 2030 who are working each in their country, wherever they may be, at the health facility, at the district, in their region or state, or at the national central level on improving immunization. And of course, today we are sharing with you the first photos and stories that we have collected over time. So to tell you about the movement, Charlotte Mbou. Oh, Charlotte needs to unmute. So,
sorry, Reda, and thank you so much. Once again, warm welcome to all of you. If you're joining us for the first time, I want to warmly welcome you to this family. You are joining the largest immunization family in the world, a community that now includes more than 44,500 health professionals from over 110 countries. It is not just about, the connections that we make with you, but more importantly, the connections you make with each other to share your experience. As your country, and all countries have adopted the 2030 agenda, the Immunization Agenda 2030, we have called for a broad-based movement that leaves no child, no family unprotected from vaccine-preventable diseases. Last 7th of March, more than 6,000 health professionals joined the full learning cycle of the Movement for Immunization Agenda 2030. The members of the movements over the next 7 weeks will develop action plans to tackle the most important and difficult challenges that they face in immunization. If you stay until the end of this event, Reda is going to give you the keys, what you need to join this great movement, even if you have not yet taken the step to do so, or you have not been able to follow up effectively so far. So Reda,
Yeah, so now at the moment of the launch of this movement, 143 women from 38 countries came together to launch what they call the Women Who Deliver Vaccines Collective. And on March the 4th, men and women from all around the world came together to affirm their support to all women working for immunization, helping to lead immunization.
Yes, and the Women Who Deliver Vaccines will open this great event. You're going to hear from them about their experiences during World Immunization Week. And right now, I would like to invite one of the women who deliver vaccines from Latin America, Maria Fernanda Monzon. So Maria, please go ahead. I see you're already unmuted. You have the floor.
Thank you very much, Charlotte. Good morning, good afternoon, and good evening to all of you. My name is Maria Fernanda Monzon. I am a pediatrician from Corrientes, Argentina. I am very proud to be participating here as a representative of Latin America. Today we celebrate World Immunization Week. We gather to join efforts to bring our countries to a goal where no one is left behind, where there is no child missing vaccines, where our world is constantly shouting out, "Long life for all," as our campaign last week was. I also stand today and now as a woman who delivers vaccines. A road of challenges starts even harder for us, as from my position, from my role, the efforts needed are more and tougher just because of my gender. But I'm not afraid of standing up. I know there are women around the world, many of them here in this room, who face these same issues on a daily basis. Women who carry the responsibility on their shoulders, and they are not afraid of advancing. I am very honored and proud to be part of this amazing group. Every story that has been shared from every corner of this huge collective of people dedicated to immunization, every story has touched my heart and has taught me a lesson and gave me new tools to overcome what is ahead of me. During all the time I've been involved with the Geneva Learning Foundation, I have never stopped gaining knowledge that supported my everyday work. The IA 2030 movement has made a huge impact in my professional life and my personal life too, of course. And this feeling of not being alone, of being part of a group of such talented professionals from all over the world, it has encouraged me to keep on going, because I know as a fact that I am also surrounded here by other strong women, women who have the capacity to overcome the most difficult situations you can imagine, because they are convinced that they play the most important role here. Because of all of this, I know that we will ensure that IA 2030 goals are met. There is no doubt in my mind. So here and now, I just want to give a short last message. Us being here matters. Us being women who deliver vaccines matters. Us being together, learning from each other matters. We can and we will make a difference. Our world is better because we care and we work to bring immunizations to everyone. Thank you very much.
Thank you so much, Maria Fernanda Monzon for that strong image. The next person I would like to turn to directly, I'm going to invite Mary Beretti Akinyi Otieno, that's joining us from Kenya. Mary Beretti, over to you.
Thank you so much, Charlotte Mbu. I'm Mary Beretti Akinyi Otieno from Nairobi, Kenya. I'm a researcher at the University of Nairobi. I came across this issue of immunization when I was in the field collecting data, and that day, the people I had intended to talk to never turned up, and upon inquiry, I was told they had gone for immunization. And to my surprise, when I later met them, it was 8 months for some of them to have their children vaccinated. So I got interested and asked them, why are they taking so long to have their children immunized? They told me that there is lack of access. They don't have it on time. And the dispensaries or health centers are far apart. And being in the semi-arid area of the country, they were unable to have it done as they would wish. And besides, there are issues of gender relations where the male parents would prefer to have their girls have to go through genital mutilation cut and not have their children go for vaccination. So when I got this, I quickly linked up with opinion leaders and women leaders in the community to have their women be sensitized on the need to have their children be vaccinated on time and have all the vaccines available. And during COVID-19, I encouraged many young girls and youth to volunteer to do vaccines like polio, which can be done by non-practitioners in the medicine. And I would urge my fellow women in the movement and many in the movement that we should take life of our children at heart because they're our future. And without having them vaccinated, we are going to lose a lot. And besides, I would also wish that we improve gender relations because during the coffees at the Geneva Foundation arrangements we have had in this movement, there was a talk that men don't support women to take children for immunization, except in Japan, where men even know where the card for the clinic is. So I would ask men, since they are the majority in the medical field world over, let them take it upon themselves that women and children should be encouraged because the world need both men and women. And with that, I know we shall achieve what we intend to achieve. Thank you so much. Thank you so much, Geneva Learning Foundation.
Thank you very much indeed, Mary Beretti Akinyi Otieno. We deliberately decided that it is the women who deliver vaccines who should open this World Immunization Week celebration. In the meantime, the messages, mostly from men, it seems, have been coming in. So let me share a few of them. So Robert Ninsen, who says happy to join an Eid Mubarak to all. Gambian joining from South Sudan. Amel Eltahir, who already introduced herself and shared her greetings with what TGLF offers. I'm quite sure that immunization future is going to be very well in favor of children and adults. I would say there's the contribution of education, but of course it is in your hands, Amel, and colleagues who do the work of vaccination every day, hence the significance of the celebration. Ruben, Emile, I can't wait to hear what everyone has to say. Good vibes, this is indeed very exciting. Deepak Kumar Petrocha says hi. Bashir Ahmad Sabdo said very exciting. Dr. Ashfaq, we're sorry Zoom's not connecting, but glad to see that you're able to follow on YouTube. Jeff Kabuika greeting everyone in our class. And Ruben says, what a powerful introduction about our first speaker from the Women Who Delivers Vaccines Collective. And Bosede Akinbolusere says, great pleasure to be part of this. Kudos to everyone. Now back to you, Charlotte. For one more speaker we've heard from Latin America and Africa. That leaves Asia.
Yeah, so I'd like to invite Dr. Satabdi Mitra, Dr. Sad, are you able? Okay, yes, I see you have already unmuted yourself.
Hello, Charlotte. Hello, Dr. Rita, and everyone present here. A very good morning, good evening, and good afternoon. And of course, Eid Mubarak to people here. Today, on observation of the last part of the World Immunization Week, that is, it is that we have to work hand in hand, everyone, mostly in the immunization section. Women are seen. They are everywhere, not only in the immunization, in the healthcare service provision. They provide service door to door. And also in the immunization section, we have seen during the COVID vaccination season, that is being themselves so much shattered, so much suffering, and having people around them suffering and having stress mentally. They have walked. We see every time the women, they carry their vaccine carriers, and sometimes they bring the children to have them vaccinated. So that it is that women are the main part, but it is also that unless there is the another half, that is the male, we cannot be complete. So in this movement, we have to work and we have to progress working hand in hand. Thank you.
Thank you very much indeed, Dr. Satabdi Mitra. Let's a collective of women who deliver vaccines. You can find their webpage online. Join the collective, listen to the full event of Women Who Deliver Vaccines. Now, we are going to continue hearing from leaders of the movement for Immunization Agenda 2030. And on the 15th of April, 632 members of the movement, scholars as we call them, achieved their very first certification in the movement. Before we began to share the photo stories that you've been sharing for World Immunization Week. Today is the first but not the last time that we will honor them. I share the sentiment. Laurencia Caesar on Facebook says she is very excited. Laurencia, do introduce yourself. Tell us where you're connecting from, what city and country. We'd love to know more about you. But now we are going to go to the certification. So there's 3 levels of certification that you can earn and learn in the IA 2030 movement. 632 finished on the 15th of April, the first level. We'll be sharing at the very end of this special event how you too can join the movement for Immunization Agenda 2030 or rejoin. If you didn't make it for this first certification, you are still, as we keep saying, a full-fledged member of the movement. So now, let us go to, we will be going in reverse alphabetical order, and we'll be sharing only the names of the countries. And you can see the names of the individuals on screen. On the 17th of June at Teach to Reach 6, we'll be doing a full commencement ceremony to honor all participants, all members of the movement, and we'll be inviting ministries of health and global and regional partners. But here, we're honoring the level 1 certification individuals who earned that certification, starting with Zimbabwe with Sifiwe Murepa. And please, if you are on social media, do share your comments, your greetings, your congratulations, your applause. Do the same if you're here with us in our Zoom studio. Next is Zambia, with one person who completed Friday in coma. From the United Republic of Tanzania, we have 5 scholars, members of the Movement for Immunization Agenda 2030, who completed a situation analysis of their most difficult and important challenge, trying to get to the root cause of this challenge in order to, in the next phase of the movement, take action, thoughtful, concerted action. 2 members of the movement from the United Arab Emirates, the UAE. 5 from Uganda. Congratulations to all of you for having made it this far in the movement. There's a series of sequential steps you will be able to join if you missed this one, or if you're just discovering the movement now. From Timor-Leste, 3 participants, 3 members of the movement. From Tajikistan, 1 member of the movement. the Syrian Arab Republic, Dr. Mohammed Salem. From Sudan, 3 members of the movement earned the level 1 certification, what we call the full learning cycle, a set of activities intended to support immunization professionals and other primary healthcare professionals working on the ground to improve immunization in primary healthcare. Sri Lanka, South Sudan, South Africa, Somalia, with 6 members, Sierra Leone with 1 member who made it to the finish line for this first lap, Saudi Arabia, 1 member of the movement, Rwanda, 1 participant, Paraguay, 1. And if you are the sole representative from your country, your task for the next phase of the movement is to mobilize and get your colleagues to not only join, but also to get all the way to the finish line with 22 people from Pakistan. I think we're reaching countries where there is more than 1 member, which means I have to go from the top. So we'll now go to Afghanistan with 2 members, and we'll go to Angola with 1 member. Argentina, Maria Fernanda Monzon, whom we just heard for the Women Who Deliver Vaccines Collective. Khadija Ahmed from Bangladesh. Dr. Mimi Lamu Minak from Bhutan. 3 members of the movement from Botswana. 1 from Burundi, an Anglophone. 1 from Cambodia. 6 from Cameroon. 1 from Chad. 1 from Chile. 1 from Ivory Coast, 4 from the Democratic Republic of Congo, 11 from Ethiopia, 4 from the Gambia, 2 from Georgia, 42 from Ghana. You can see the screens of names, 3 screens to show the Ghanaian participants, 1 from Guyana, 24 participants from India who've made it to the finish line for this first round, first lap of the full learning cycle. You can see their names here. Indonesia, 2. Iraq, 1. Dr. Ahmed Mohamed Niyama Abu Ragif. Kamisha Shaw Kelly from Jamaica. 16 from Kenya. 7 from Liberia. 1 from Malawi. 1 from the Maldives. 4 from Myanmar. 1 from Nepal, 1 from New Zealand, and 122 from Nigeria. This is the second screen. And I believe there are 5 or 6 screens, 7 screens to honor Nigerian colleagues who made it to the finish line for this exercise. 22 from Pakistan. I believe we've now closed the loop, and that is the members of the movement who made it to the finish line. We're now going to hear from these members. Charlotte is going to tell us who we shall hear from first, to tell us about what they learned, what they gained by through this situation analysis exercise that was key to the first phase of the Movement for Immunization Agenda 2030. At the end of this special event, we'll be telling you what you need to do if you want to join the movement now. But Charlotte, shall we hear from now?
I'd like us to listen to Dr. Bile Nestor Binka, whose mic is already unmuted. Reda, I hope, Nestor, that connectivity is on your side today. Over to you. And the questions on the screen.
All right, Bile Nestor. All right, Nestor and Binkar, it looks like, okay, I just heard a microphone connecting. Nestor and Binkar, are you there?
Yeah, I'm getting you. Good afternoon, good evening, or whatever time it may be. Eid Mubarak to all the Muslim scholars. I'm Dr. Bilan Nestom Binkar. I'm the District Medical Officer for Kumbo East Health District in the Northwest region of Cameroon. I work at the district level coordinating the implementation of high impact health interventions, including immunization activities. Yeah, the challenge for IA 2030 that I took was a poor uptake of measles, rubella 2 vaccine and contributing factors in Kumbo East Health District. Actually, I had so many challenges, but I decided to focus on measles, rubella, the second dose of measles, rubella vaccine. what prompted me was the current major epidemic that was affecting 9/10 regions in Cameroon. And although I have not yet confirmed any case in my district, I thought that it was necessary for me to assess how safe my communities are, given that the epidemic had already affected some health districts within the region. So from my findings, I discovered that MR2 coverage in health areas was very poor, ranging from 7% to around 83%, and the majority of health areas had a coverage of MR2 less than 50%, and none had the recommended 90%. More than half of the health areas had a dropout rate of more than 10% between MR1 and MR2 vaccines. So the contributing factors were poor coverages, including poor immunization in communities, including poor sensitization, in communities. We had unrealistic population estimates, poor follow-up of dropout cases, a lack of appropriate data collection tools and in some health facilities, and data entry errors and shortage of vaccines. But based on these findings, the main root cause that I could identify was poor sensitization in the communities. And with this poor sensitization, health personnel were not also left out. It is also important to note that we have some structural causes that they need to be taken into consideration, and one of it is due to the armed conflict that we are experiencing in the region, and the population has been displaced, and health facilities need to carry out more outreach activities before the people can have access to health services. So with the difficult economic situation faced by these health facilities, financing of these outreach activities have become a problem, and few sessions of outreach sessions are being organized. So for actions to be taken, I think the first action would be community engagement meetings and sensitization. With these community engagement meetings, the aim will be to bring together immunization staff, community health workers, and other stakeholders from the community that have an influence in health-related activities. During this meeting, the situation of the health areas concerned will be presented, and the following recommendation and the possible recommendations aimed at improving the situation will be made. But before getting to the health area level, there will be a meeting at the district level where the immunization staff from all the health areas and other stakeholders will be brought together to brainstorm on the challenges before the information can be taken forward to health areas. Then the second possible thing that I am proposing will be more outreach vaccination activities or periodic intensification of routine immunization. We call it PIRI, which needs to be organized. And with this session, we think that I personally think that if we have one every 3 months, it could help to boost the vaccination activities within the district. For what I will need as support, we need financial support, especially to organize these community engagement meetings at the district and health area levels. We also need support to immunization staff who will be carrying out the periodic intensification of routine immunization every quarter.
So Bile Nestor Mbikar, it's obvious you put a lot of thought into your situation analysis. Are you a leader of the movement for Immunization Agenda 2030? Why or why not?
Yeah, I consider myself as a leader of IA 2030. I came across the Geneva Learning Foundation through a colleague who forwarded the link to our WhatsApp group. So from that moment that I discovered that we are talking about immunization here, I said, no, I cannot sit behind, and I need to be part of any immunization activity that can help me improve on the coverage of immunization in my district and even beyond. So I immediately joined the movement, and I'm coordinating a health district with 39 health facilities, and I think.
So let me ask you my next question. You joined. We all started on the 7th of March, so that was barely 2 months ago. How has the movement made you see your world and your work differently? What has changed for you by being connected with thousands of fellow immunization professionals? Does it actually make a difference in your everyday work?
Yeah, actually, it has really made me to see things from a different dimension, and especially through experience sharing and the ideas engine. I learned that the immunization, I learned from immunization colleagues in different countries, and I discovered that the challenges that I was facing in my own level were almost similar to those faced by colleagues elsewhere. And I also learned one important thing, which is motivation. And for us, we are working in a challenging health district, which is considered to be the epicenter of the conflict that we have in our region. And at times, it's very difficult for us to move, difficult for us to carry out activities. So what we really need is motivation. And when we are motivated or when we are encouraged to carry out our activities, the output is always very good. For example, during our last COVID vaccination campaign, I decided to visit only health areas that were very difficult, that had very difficult access, to encourage the staff who were working there and even assist them to carry out the activity. And we had a very good coverage. So I think one important thing that I've learned from the movement is that this aspect of motivation, how it helps to improve on immunization.
Thank you very much indeed, Bile, Nestor, and Binkar. There's so many comments coming in. We have one more speaker who is a leader for Immunization Agenda 2030. We believe it. It's up to you to say if you take up this challenge of helping to serve others through the movement for Immunization 2030. Now, we have, all right, let me see if I can pick out some of the messages. So Vicky Tambwe, who says, I was so happy for our day, this great event, especially all the scholars, especially for the end of the first cycle, the situation analysis. Let's see, Kamisha Shaw Kelly from Jamaica, great to have the Caribbean in the house, even if didn't make it to our Zoom studio. Let us know what's on your mind, what your thoughts are as right after World Immunization Week. Yahar Zimbo says, now I'm reaching an excited celebration and long way journey during the times of crisis in my country. Proudly participate, and says congratulations to you all. Dabire Ernest from Burkina Faso. And then please don't just say hello, tell us what's on your mind. What brought you to this event? Why are you participating in the movement for Immunization 2030? And then Mukhtar Suleiman from Kano State of Nigeria. Julie Mumba says hello, and Judith Mamora. All right, back to you, Charlotte. Who shall we hear from next, even as the comments and keep coming in?
I would like to invite Laurencia Caesar. Laurencia, I don't know if you're able to unmute yourself.
Hello.
Okay, I see you're unmuted.
Hello.
Yes,
please go ahead.
Yes, I would like to congratulate all scholars for coming this far. I am Laurencia Caesar, a community health nurse in the central region of Ghana. And for my IA 2030 challenge, I spoke about the high dropout rate of first dose of measles, rubella, and then yellow fever vaccine. And this was indeed a really big challenge because we had low coverages in both vaccines. And what I realized was it was due to urbanization. Some mothers traveling in from different places to deliver. In Ghana, one of the things we do here is that when you are pregnant and it's about time for delivery, it's either you travel to your mother's place or your in-laws' place. So we had some people coming in to the village where I work, that is Odobin Health Center. For these people, children, when delivered, we are able to give them the BCG vaccine. And then sometimes the first dose of Penta, PCV, OPV, and then Rota. And then we got to realize that at 9 months, we are not getting such children. So what was the root cause? So that is one. And hello, can you hear me?
Yes, we're listening to you.
Yes.
Yep.
Yes. And then if the actions I decided to take was that if we could create more outreach points, because some of these people were in the hard to reach areas, we could create more outreach points. And then if we could sometimes make a phone calls to know whether they are around so that they come for the vaccination. And let me go straight to the fourth question. Yes, I am a leader of the IA 2030. And this movement has really inspired me a lot. Initially, I thought the challenges we are facing was just in Ghana. But as the first speaker rightly said, I got to realize that I am not alone. And through the ideas engine, I learned a lot from my colleagues. And then we shared ideas with the twins, the pairing of you guys did for us. I got to learn from my twins as well. And then this agenda 2030, Immunization Agenda 2030 has also boosted my morale. Yes. And what I will do for my colleagues to join this IA 2030, I've already started sharing on other social media platforms. I shared on WhatsApp and then Facebook. So that is basically what I have to say. Thank you, and over, Charlotte.
Thank you very much indeed, Lorenzo Caesar. Now, I hear Charlotte. Yes, with the music, sometimes it's hard to hear, but this is a celebration. So we have now 702 health professionals who've already shared a photo and a story. That was as of this morning. So we've actually received over 1,000 photos by now, if you can imagine, in just basically in 1 week. So first of all, we do want to celebrate that and just thank you for the trust in sharing these photos and helping to share what is your daily reality. What is the work that you are doing when we talk about vaccination, about immunization? What are we actually talking about? And so we are now going to go through the third component of this special event, which is actually sharing the photos with you together with Charlotte. Charlotte, how's your connectivity going?
So far, so good, Reda.
All right. Before I do that, I see more messages piling up in social media. So just to say, let me see. So just to pick a few, and I'm sorry we can't share everyone's messages, from Raul Sao, who says, great, we must always find a way to overcome challenge when it comes to reach vulnerable with vaccination services. I know that if Raul said that in a room, if we were sharing a physical space, there would be applause. So I believe it is legitimate to be sharing it here. And Adediran Oluwayemesi says, proud to be here. That is also a sentiment that I believe must be shared. Haruna Mohammed Al-Majir from Nigeria says, I am there. Glad you are with us, Haruna. And then Shahid Iqbal says, hi. Right. There are, for those of you who are not able to get into the room, we have the highest capacity Zoom room with 1,000 participants. So that's why we said to you ahead of time, you can always watch on social media. We really appreciate the trust and the commitment to actually celebrating what we're doing here together today. So let's get started. So some photos we were not able to use for various reasons. We won't get into the details, but you'll be seeing in chronological order, meaning the order in which they were received, the actual pictures. So let's get started. We're going to switch the music a little bit, I think. And there we go. All right, Usman with a photo from Niger States.
We have Evans Paul Amoasi from Kojo Gada, Kisi sub-district in Ghana.
And Binish Mehbooba from Karachi, Pakistan. I want to say Binish, unfortunately, made a typo, which we've now corrected, I'm happy to say. I hope you're here and listening, so you know this, Binish.
So we have Rizwan Ahmed, that is from the Basic Health Unit, Bone, Muzafta District, Ukara Province, Punjab, Pakistan.
Muzamal Shabir, Shah Colony in Pakistan.
Syed Miraban Shah Syed Bhai, that's from the Nangarhar Regional Hospital, Children's Ward in Afghanistan.
These are your pictures, your photos that you've entrusted us, and we're proud to be sharing them back with you. This would also give global regional partners who haven't been able to travel perhaps a taste for what I know some of them have been missing, which is to actually travel to countries as they support your work. Dr. Ghulam Murtaza from Bubado in Pakistan.
Mustafa Mohammed Chidawa from the Primary Health Center, Jeba Mokwa Local Government Area in Niger State in Nigeria.
Edward Soko from Nambazo, HC Falambe in Malawi.
Matthias Mariaki from General Hospital Mina in Nigeria.
Andrew Jabani Mamza from Pulka Gwoza, LGA, Borno State, Nigeria.
Kuluma Behanyu from Aboso Health Center in Ethiopia.
Eugenia Fashima Ainigba from the Remain Gado Comprehensive Health Center in Nigeria.
Haruna Chinapi Peter from Baro Diko Teaching Hospital, Kaduna State, Nigeria.
Chidima Joanna Chiechefu from Mangu Orientation Camp in Nigeria.
Idris Musta from Rijau, Niger State in Nigeria.
And Riak Iyak Ajuash Riak Bai from Al Sabah Children's Hospital in Juba in South Sudan.
We have Matthew Lado Joker, that's from South Sudan.
Abu Bakr Musa from Zuro Kebbi State, Nigeria.
Dr. Mariat Soleye, Makoko Riverine Community, Nigeria.
Iqbal Alhaj Ashwal Kambal from Al Tadmon Health Center in Sudan.
Helena Koko Kamara from the Western Region 1 in Banjul, the Gambia.
And Dr. Ndayo Akpan Iwat from the Nigeria Federal Capital Territory Primary Health Board in Nigeria.
Mulwalem Bulka, that's from Benishangul Gumuz, Odabu Digru District, Godel Place in Ethiopia.
Aminu Mohammed from Lagos, Ebute Meta House in Nigeria.
Omorodion Lovett, that's at the Military Hospital, Lagos, Nigeria.
Azuka Chinwe Grace from Oju Primary Health Center in Nigeria.
Abnet Samuel Abiyu, Brooks Point Health Center, Palawan in the Philippines.
Peter Mutai from the Iton County Referral Hospital in Kenya.
Nicolas Chata, Tujere Health Center in the Gambia.
Edward Mbonigaba from Niagatare District in Rwanda.
Mary Eke, Ghana's EPI Ultra Low Temperature Cold Room, that is in Ghana.
Landing Jarju from Fajikunda Major Health in Talinding, the Gambia.
Kamran Shehzad, Basic Unit 136, District of Kanewal, Punjab, Pakistan.
And Professor Becky Tagbo from the Institute of Child Health Immunization, Clinic University of Nigeria Teaching Hospital in Enugu, Nigeria. We're going to mark a first pause here, and please share your comments. Let us know what you are thinking and feeling about your work, viewing these photos, the work that you do every day being shown and being shared with fellow immunization professionals, as well as global and regional partners from all over the world. We have Osede Akinbolusere. It says congratulations. So again, the photos are not the completers or the ones who've earned certification, but your comment to keep the fire burning still applies. Bosede, thank you. So now back to you, Charlotte.
Dr. Rizwan Azgar, Royal Center, District of Lolhan, Punjab, Pakistan.
Mohammed Kolo Isa from District Head Palace, Chibok. This picture is from LGA Borno in Nigeria.
Dr. Radna Shakia from Balmandi School, Kathmandu in Nepal.
Samuel Achiampong Pepra from Ghana.
Ibrahim Sarki Zoaka, Balko Settlement, Sabon Bini Ward in Nigeria.
Japheth Mbinda Ndoni from Kenya, Mkitwi South Sub-County Vaccines Depot.
Dr. Iyata S. Wapwe from the Sham Girls Academy in Liberia.
Dr. Mohammed Ashfaq Utmanzai from Charsadda, Pakistan.
Joyce Yenuya Dut from Ghana, the Chef's Compound.
Markinara Isaac from Nigeria.
Mia from Ghana's Chill Bongo District, Josephine Mobire Akurugu.
And Elizabeth Ishaku from Nigeria.
Rajintesh Kumar from India.
Dr. Irfan Ahmad from Pradesh, India.
Mike Tuka Kumar, Saint Dominic College and Parish in the Democratic Republic of Congo.
Dr. Mohamed Yakubu from the Balewa University Teaching Hospital in Bauchi State.
Dr. Manisha Danan from the Lifeline Clinic in India.
And as you view these pictures, you can pick your favorite. You can decide which one speaks to you, which one is powerful for you when you look at this picture, for example, of this pediatrician with a child that is under her care, that she is going to help protect from vaccine-preventable diseases. Kalejaye Olasunkami from Niger State.
Abdiwali Mohammed Aden from Muduk, Somalia.
And Isabella Panunzi from the Centre de Santé Mbalanzim in Bangassou, Central African Republic.
Mustafa Sani from the Primary Healthcare Department, Ikara, Nigeria.
Ahmad Abubakar Wara from the Health Center Wara in Nigeria.
Nelson Mandela Albert from Juba, South Sudan.
All right, that is just the first set of photos that we received. We received them in the order that they came in. As you can see, a very mobilized, very active Nigerian community, but also many, many other countries represented. This does not end here. This is only the beginning. We obviously do not have time, and you do not have time to see all of the 1,000 photos we've received. So we'll share. Charlotte actually is way ahead of me. She's already shared the links. You can find, if you can find one of the pictures, you can find them all. And I'm actually going to demonstrate in a second. Hopefully I can do this to see. Okay, and I see our social media has really already blown up. So if I go to my Twitter feed right now, you can see that there are 20 plus notifications. And why does this matter? Well, this is your story. You can see many more are coming in. Thank you, Osiela Odera. Thank you, Joel and Getish. Thank you, Connie Luthi, Norbert, all of you who are making a difference. Why does this matter? Because your story, the story of how immunization happens on the ground, is your story. No one else can tell it in the way that you can by sharing what your daily work looks like. So before we close, we have two things we want to do. One is we do want to acknowledge the full set of 701 contributors as of this morning. We'll be updating this list and sharing it on our social media in the coming days. But these are all of the folks who have, and you can see there are 8 screens. So if you don't see your name right away, don't panic. 701 contributors, just absolutely amazing. Here, these are the E's, from E to J, from J to M, from M to N. So congratulations to all of you. You're sharing your story in your own words, in your own name. And if we haven't shared yet, and some of you are getting impatient saying, how come my picture hasn't been shared yet, do not despair. We'll get to it. There's a few that we cannot publish for various reasons, but you can also share it yourself and send us the link. That is really the key for what you can do if you really want to make sure that your picture is out. All right, so that is to show you the pictures. Now, Charlotte is going to tell us who we're going to hear from, and we have just this message that I think is especially, I think this is worth applauding. Lynette Apindi, who says she's happy to celebrate with my fellow healthcare workers. Lynette, please tell us where you're based, which city, what country, where do you work? We'd love to know, to hear more from you. Charlotte, I see Dr. Manisha Danan, who's very active on social media and whose interventions as a member of the movement for IA 2030 we've really appreciated. Is she going to be the first one to speak?
Definitely, Reda. I really want to understand the context of the photo that she shared.
Hello.
So over to you, Dr. Manisha Danan.
Thanks a lot, sir and ma'am. Hello.
Yes, we can hear you.
Yeah, thank you, ma'am. Thanks for the appreciation. And based on situation analysis, my logo was a global humanitarian response plan for COVID-19, and vaccination is required. Why? Because it's a need of the time that we should have universal immunization to reach each and every human being and take care of vaccine preventable diseases. The most important part of primary healthcare and universal health coverage is vaccination. A global humanitarian response plan for immunization is required, as immunization is the first step towards healthy future of our company, our family, and our future. The action we had taken was we included all the CSRs, NGOs, and weekly meeting with citizens. So in Maharashtra, India, the vaccination rate and immunization rate is 98%. The next thing I am very much thankful. I had mentors like you both to appreciate, and whenever I was falling behind because of the technical knowledge, you had always appreciated, boosted my confidence. Yes, and the way Reda sir said, I am working to prevent my pediatric patients from vaccine preventable diseases. I'm working for non-communicable diseases and implementation of the preventive healthcare also. I'm thankful and glad that you had given me this opportunity on this very beautiful day, 2nd May, and happy Eid to everyone. Thank you, ma'am.
Thank you very much, Dr. Manisha Danan. I think what everyone in the room wants to know, Dr. Manisha, is can you tell us a story of this picture with this little girl sitting on the table with you? There's obviously a lot of warmth, a lot of care with you and this little girl. Can you tell us more about what this picture means to you?
So it means a lot to me because each and every pediatric patient who comes to me comes with a hope, with a liking, and I love that. And the way I have holded her, I take care of each and every patient. Though I don't personally vaccinate any of the patients, I send it to the senior doctors, but I have seen and cared. And this one is my favorite patient who was there with my new clinic opening for the first pediatric patient. And I have seen to it, I do it for each and every patient the way I have cared for her. And the very language you use now, sir, this way, I am preventing these kids from getting vaccine preventable diseases. I thoroughly, from the depth of my heart, do this for each and every patient.
Thank you very much indeed, Dr. Manisha Danan from India. This is very much, and I know there are many doctors, nurses, health workers in the room who know what Dr. Manisha is talking about, and we learned so much. You shared so much with us about your motivation. We'll be sharing the full photo book with members of the movement, and I think we'll hear one. Maybe we're running out of time, which hopefully will leave you hungry for more. Charlotte, who shall we hear from next?
I'm inviting Syed Miraban Shah from Afghanistan. Really want to hear him share. Syed, I don't know if you're able to unmute yourself.
Good evening, everybody, and Eid Mubarak. This is Syed Miraban Shah from Afghanistan, Technical Officer of WHO Country Office, Afghanistan. Thank you for giving the opportunity to speak about the situation in the country in Afghanistan. That we are really suffering from vaccine preventable diseases, and a lot of children are dying of. Even though vaccines are available in Afghanistan and the system is working in Afghanistan nowadays, and it is supported by the financially supported from the WHO and the UNICEF, and the system is going on and vaccinators are available, but still we have losing our children. And particularly regarding the measles situation in Afghanistan and the outbreak response, we have conducted recently, but still it not worked because we didn't cover all of the district in Afghanistan, and we have only
I think we've just lost Syed. Let me try unmuting him again, but all right, Syed, it looks like we may not be able to. At least there's one thing we can do, which is to look at his picture, even if he's no longer able to speak to us. So he said this is a picture when he visited the regional hospital, and particularly the children's ward for unimmunized children suffering from measles. He checked the child register for measles cases, and he found that 20 beds were allocated for measles cases, but more than 100 children were admitted in the ward and lying on the floor since there was no bed to them. I think Syed is back. Syed, do you want to conclude? We have to. I'm sorry that you were cut off, but we hear you again now.
Okay. Thank you, Rida. There was someone calling that for that reason I think it was disconnected. We have planned to conduct the second phase in 111 districts to stop the circulation in measles in Afghanistan, and this is very hurting as that children are dying because of for which we have vaccine in the country, and vaccines are available at the district level, at the village level, because the health system is working like the district hospitals, comprehensive health centers, basic health center, and sub health center, and mobile health teams for those areas which is difficult to reach or hard to reach, or the communities are unable to go to the health facilities, or the distance are more than 2 hours by foot to travel to the health facility. And the other issue is the unavailability of female vaccinators. As before we have discussed, the women are delivered, because the women's in conservative society like in Afghanistan, where female can or women can play a vital role in the reduction of such vaccine preventable diseases and morbidity and mortality in Afghanistan. And we don't have such qualified vaccinators in remote health facilities in remote areas, and we are trying with the partners with the MOPH to deploy female vaccinators, and at least one female vaccinator in each health facility, where women can easily go there and vaccinate their children and women of childbearing age to eliminate measles and also neonatal tetanus and other vaccine preventable diseases in the country. So this is the situation, and for that reason I put this idea and idea engine, and I have done my situation analysis on this topic, and I got scholars feedbacks, and I respond to those feedbacks. I am really thankful to those authors who respond to me and give me feedback on my situation analysis, and how to improve my situation analysis, and how to work in the future in Afghanistan. I have learned a lot of things from this movement. Really, it give me motivation, and it give me more energy to work more hard than before, and for the children of for the sake of the children, and for this for to save the children from this vaccine preventable diseases in Afghanistan. Thank you, and our.
Thank you very much indeed. Solidarity with colleagues working in Afghanistan. and everywhere for those of you who are working in so-called fragile contexts. Syed mentioned the movement for immunization, so I'm going to tell you a little bit more about that. But the movement is on because Charlotte has been posting the links, and when we go to you can see 63 of you have already shared, reacted. Remember to share, don't just like, because that will spread the web, the circle of people who can hear about the movement. The same is going on Facebook. Thank you, Kwazi Abdul Basit, and then on Twitter as well. So this is, in today's digital age, this is how we spread the word about the movement for immunization. And you may be wondering, what is this movement? Is this something that is official? Is this, who has sanctioned this? So we need everyone. And it is actually at the 74th World Health Assembly that the Director General of WHO called for, he said, a broad social movement for immunization that will ensure that immunization remains high on global and regional health agendas and help to generate a groundswell of support or social movement for immunization. If you are a health professional, I do not need to explain to you what this means, that this comes from WHO. The Immunization Agenda was adopted by your country, by every country, at the World Health Assembly in 2020. Now, our part in this is, as an education organization contributing to the movement, one of many working to support the movement. What we believe is that your commitment, whether you work in a health facility, a district, a region, or a state, or at the national level, is what can make the difference for children and families in your country. And why you matter is that Immunization Agenda 2030, the world strategy for getting to the immunization and primary healthcare goals, is that you are the key to leading the change that is needed. In the context of our contribution to the movement, we're currently running the full learning cycle. I'm going to mark a pause now to ask you to type yes if you face any of these challenges. Now, whether you're on social media or whether you're in our Zoom studio, we have just a minute left, but I want to tell you what is coming next and how you can join. So if you are facing any of these challenges, if you are facing children who are unvaccinated and missed communities that you know about, you know they're there, and you want to do something about it. Perhaps you already are. If you're facing epidemic outbreaks of measles, yellow fever, other diseases, if you're facing lack of confidence in vaccines by the community, I want you to type yes into the chat or in social media, wherever you are. Even if you're watching the recording, we'll know. If you are trying to reach more marginalized community, if you're trying to overcome gender barriers to immunization so that all women, girls, men, and boys have equal access to immunization services, we want you to work in the movement on your biggest challenge, including that maybe successfully vaccinating against COVID-19. And I see a lot of yeses, too many to keep track of. I was hoping to read some of the names, but what I want to tell you now is next Monday, so in just exactly 7 days, at exactly the same time as today, we'll be kicking off what we call the first IA 2030 Action Plan Hackathon. What this means is that you can come in, spend 1 hour, and then leave with an action plan for your most difficult challenge that you're facing that is preventing you from ensuring that every child, every family is protected from vaccine preventable diseases where you work. You will not be doing this alone. And once you have your action plan, starting on the 23rd of May, we'll ask you a very simple question. Are you ready to take action? And if you answer yes, you will have to opt in. You can also at any point say, I'm okay, I just want to do my daily work. But if you join the Impact Accelerator, you'll be working with hundreds, perhaps thousands of fellow health professionals who are all of us, all of them, all of you will have an action plan and will be trying to implement it. And every week for 4 weeks, you'll be sharing your successes, your lessons learned, your challenges. That is what we call the Impact Accelerator. And we're not going to ask you this now or here because we are unfortunately already out of time and over time. But I'd like you to think about in this coming week and to look in your inbox, check your inbox for messages from the Geneva Learning Foundation. We're going to be sending you the invitation to join the Action Plan Hackathon and the Impact Accelerator. What is your most difficult and urgent challenge? That is what we'd like you to think about. And then second question, what support do you need? Those are the two things. We're working with what's called the working groups of Immunization Agenda 2030. Very interested in the work you're doing and the difference you are making. So that's it for this session. Thank you so much. Sitabdi, you motivate me. But thank you. And to all of you, there's again too many messages to share, but let me share a few. Happy Immunization Week. That's from Danjuma Abdul. Jumali says happy to celebrate. Eid Mubarak. Sadiq Nasiru Garba. It's a great pleasure to be part of this great family at this great time where thousands of healthcare professionals join to celebrate this day for the life of our great vulnerable population. Now, celebration does not mean the work is done, but celebration is about motivation, rekindling the spirit, the reason why so many of you are in immunization in the first place. All right, Fabiola wasn't able to connect on Zoom. We explained, we warned you that we might be over capacity. Hello to Lucille Plourde Owobi in France, who works on vaccine research and development at Sanofi. Abnel Samuel says hi all. Now remember, before you go, I'd like you to go and share the photos. This is your story. And this is the story of your colleagues, of the work that you do every day. So if you have not done so yet, just follow the links, pick one, share it, and then of course post your own and send us the link so we can keep sharing and spreading the word. Look forward to seeing you on the 9th of May. And again, you choose if this is something you want to do. If you do it right, the time you spend with us will be helping you with the challenges that you face, whether it's the Action Plan Hackathon or the Impact Accelerator. That's it for today. A year ago, we asked you the question, what is the future of immunization? You're certainly part of the answer. Thank you so much for this World Immunization Week celebration. We're going to hear one last time from Charlotte, and we wish we could turn on all the microphones or do what humans would do. If there were hundreds, there's still 389 people in the room, even though we're over time. Charlotte, what are your thoughts and what are your emotions? Can you channel what you're hearing and feeling from the room before we close?
Rather, I'm hardly ever dumbfounded, but actually right now I'm trying to look for the right words. I just want to celebrate all the members of the Movement for Immunization Agenda 2030, first and foremost for the work that you do on a daily basis to ensure that our populations, our families, our children get the vaccines that they need. And looking from the picture stories that you shared with us, you work in all kinds of situations, the difficult situations. You have to go across get to some waterlogged areas, some areas that are difficult to access, some security compromised areas, all for the sake of the children, for the sake of our communities. And we just want to say kudos to you for all of that. And thank you for taking the time to come today and share your experiences with us. And I just also want to greet and recognize the partners that joined us for this great event that have been following and seeing through the eyes of the scholars what is happening on the field. So I wish a happy Eid to all those who are celebrating, and look forward to connecting with you again on the 9th of January, just like Reda said, and continue to share, to like and share the pictures, as well as share your own. We want to know your story. Thank you so much, Reda.
Thank you.
It's been a pleasure as always.
Because there's still 374 people in the room, what we're going to do is we're going to rewind. We're going to show the photo album again. So stay with us. If you want, if you need to go, if you have urgent work, then please, by all means, get back to work.
Oh,
So we're just getting started. You can keep sharing, and we'll continue to share the over 1,000 photos that we've received just in the last 7 days. Even though Immunization Week may be over, the work of immunization, the work that you do every day, is far from done. Even as we celebrate the launch of the movement that kicked off on the 7th of March, we look forward to what comes next. You still have 250 people in the room, so if you're still here, if you haven't shared yet, please do so. The event is way over time now, 10 minutes over, but we love sharing with you, and if we could, for those of you, we know some of you, we could certainly stay several more hours sharing experience, learning from each other, but we know we have the urgent work of immunization to get done. If you struggle with connectivity, of course, I encourage you to go and subscribe to our podcast. You'll sign up on our website, you'll get the links, and then you can listen at your convenience in an audio format. So if you have to pay for bundles, if you don't have a good, reliable Wi-Fi, so you rely on your phone, this is a great way to keep listening to the experiences being shared, listening to your colleagues, while minimizing the expense involved. That'll be my final message for today. Take care.